Well, if you were watching last week, you might have seen our segment delving into the causes of those spider veins, the swelling, and other painful or unsightly leg conditions.
This week we're talking about the best treatments available. Dr. James St. George is joining us once again from the St. John's Vein Center to go over, well, we went over some of the stuff last week, but what are some of the main vein, that sounds kind of cool, main vein problems that you guys see at your clinic?
Well, you know, as we talked about in the past, we have both cosmetic and medical issues. And, you know, I would like to use this segment to kind of do a little show and tell.
Okay.
Pictures worth 1,000 words,
That's
right?
true,
So
because a lot of people can look at the pictures and say, I have that.
Exactly, and a lot of people don't realize that they actually have a maybe just cosmetic or maybe something more serious. So
what are we looking at here? What is this?
This is what it's all about. It's all about gravity. So veins move your blood up your leg by using these valves in the veins to keep it from falling back. So you notice on the right-hand side is an abnormal vein. The blood is actually falling down the leg, and over the course of the day, it leads to the issues such as spider veins and varicose veins.
Okay, so let's take a look at some of the pictures, and then you can tell us, you know, when it turns from cosmetic to potentially needing some medical attention. So what is this?
Well, here's an example of a typical cosmetic spider vein. A lady with these veins all over her thighs. They range in size from 1 millimeter or less. That's what a spider vein is, 1 millimeter or less. And they can just be cosmetic, and we treat these with injections called sclerotherapy.
Okay, and now do you inject each individual vein, or how does it work?
It's a lot of little tiny injections. They don't hurt. They're more annoying, somewhere between like a spider bite and tweezing your eyebrow. And this lady, if you notice on the far left-hand side, you'll see a little blue vein kind of leading to this group of spiders on the right.
What does a blue vein mean?
And they're called a reticular vein. Reticular veins are feeders to these spider veins. And it's very important to inject those reticular veins in order to make the spiders go away. A lot of reticular veins in a calf. Here you see lots of blue veins all over the front of the calf. If you don't inject these veins as well as the spider veins, the cosmetic result will be poor. But more importantly, this may be a sign of a medical condition.
And does it lead to this? And what is happening here?
Pretty bad, isn't it? This is a lot of, they're really still spiders, but this lady has lots and lots of tiny spiders in her foot. This is really a sign of an underlying medical condition. Here's a much more extreme version of that with lots of dilated veins in the foot and ankle, really a sign of a condition called venous insufficiency.
Does it have to get to that point before you realize it needs medical attention?
It shouldn't. I mean, I've seen patients with really bad venous insufficiency, they may have no veins. So that's why it's very important, in any time you get any treatment for this condition, to make sure you have an ultrasound before actually proceeding with treatment. Particularly if you're spending hard-earned money for cosmetic treatment. You want to know you do not have the underlying medical condition.
Sure, yeah.
And untreated, these things progress. You can get darkening of the skin. You'll see in this picture very faint bruising like of the ankle. Well, that can get much worse. Here you see it much darker and more prominent spiders at the ankle. This is a medical condition that needs to be treated with more involved procedure. Here's eczema. That's a sign of advanced condition. Untreated, this can lead to some significant skin changes.
Now, is this painful? This looks painful. Is this painful for someone who has this?
People can have throbbing. They can have pain in their legs, swelling, discomfort. It can cause achiness when they wake up in the morning, or much worse as the day goes on. Their symptoms get worse, the swelling gets worse, the pain gets worse. It is symptomatic as well as just visual.
And you can treat that.
It is. It's very simple to treat. It's in office. It's not an involved procedure like it was many years ago. It's a simple office procedure, not much more complex than treating the spider veins.
And that's you're talking about the medical there, or are you talking about the cosmetic? I know the cosmetic you said is just the simple little needles.
Simple injections.
A little bit annoying. But what do you expect when you go in more
for the medical condition, when we get into varicose veins like in this picture, this is really a sign of, you don't need to be a doctor to see this person has a problem. And these varicose veins can be much worse. They can be the typical bulgy, ropey type veins you're seeing here.
Yeah, I've seen that.
And this, you know, can be very painful to some patients. Now, to treat this condition, it's in essence the same principle as these spider veins. You want to close the vein. People can have swelling. Look at this gentleman's left leg, how swollen that calf is. Bilateral leg swelling, very severe swelling. This leads to patients who have a lot of discomfort with this. This affects their day, the quality of their life. If they're on the workforce, if they're on their feet in their job, it makes it very difficult to get through the day with this kind of symptoms. And this is really an advanced case of just years and years of this problem.
Right.
But to treat this, in essence, the same principle, you need to close the vein. So we put a very simple intravenous catheter in the vein, and we use a special catheter that heats the vein and seals it shut so that blood can't fall down the leg and lead to all these symptoms plus all these chronic changes in the skin.
Let me ask you this: when you see, because you see like multiple, it looks like a lot. Is that one vein? Would you go in and put one into one vein, and that would control all of those that we're seeing?
That's a great question. Veins are really, in simplistic terms, like a tree. So you have a trunk, and then big branches, medium branches, and then small branches. The branches are affected by what's going on in the trunk. So we want to address the trunk, and that's what we call the saphenous veins. And there are a set of veins right under the skin that are very long. The great saphenous vein is the longest vein in your body. And when that leaks, those valves don't work. It's a straight shot down your feet. That blood just falls all the way down to the ground with gravity and pulls in your lower leg. It leads to all those changes in the ankle that you saw
So it's
earlier.
not multiple splints or whatever you
start
call it.
with the big
It's
vein.
the big one, and then you see where it goes from there.
Start with the big one and then work your way
very
down
cool.
to the little tiny ones.
And if someone has questions, they can just come in. We run out of time, but they can come in and just get a free assessment from you and just figure out, do I have a problem, yes or no, and is it a medical condition? And you can help them with
Absolutely. We can tell in a matter of minutes with a quick ultrasound, a screening ultrasound, whether you have a medical condition or it's just cosmetic. And if it is a medical condition, most insurance plans cover this.
Great. Thank you so much.
Thank
we
you for
appreciate
having
it.
me.
Dr. St. George's for the great information, as well as St. John's Vein Center for sponsoring this segment.
Remember, there's no charge for an initial consultation and screening ultrasound. Just call 904-402-VEIN. That's 8346. Or you can log on to St. That's an ST, johnsveins.com.
Man,